Good evening, everyone. Thank you for joining the webinar. We are going to get started. I know there's some people still logging in, but I want to get started. So we have a great opportunity to go over a wonderful webinar that we are having today. So good evening, good evening, good evening. Welcome to the webinar and the American Red Cross. We're going to go over some skills today, and it's how can you help? And I know everybody is getting ready for a competition that's coming up soon. We want to get you prepared, go over some CPR, some basic skills, some BLS skills to get you prepared for the competition. If you're not entering the competition, this is a great opportunity to get a class and with the American Red Cross and learn basic CPR skills and BLS skills. So we're going to go through a quick PowerPoint presentation. I will go slow just in case you want to take photographs of the PowerPoint presentation. There will be a session at the end for Q&A, and this is going to be recorded. So you can play it back and you can go back and see it and review it as many times as you want to. But if you want to take some photograph of the slides for some information for your reference, by all means, please feel free to do so. Today, again, welcome, welcome, welcome. Good evening. This is a first aid CPR AED review. We're going to go over some basic skills for first aid, CPR, AED, sudden illness, and some choking for adults and for infants. My name is Al Clinton, and I am a CPR instructor, trainer, and educator for the American Red Cross. My mobile number is on the screen as well as my email address. If anybody has any questions when this seminar is over, or if you have questions on taking a class at the American Red Cross where you are located, or if you have any family or friends located in a different area and they want to sign up for a class, I will have some information at the end of this PowerPoint presentation to give you some opportunities to get the information so you can sign up for a class. But if you have any other questions, by all means, please feel free to reach out. The American Red Cross, we're going to go over some components of adult CPR. And for some of you who have taken a CPR class before in the past, some of the information on here may be a review. For some who have never taken a CPR class before, some of this stuff may be very new to you. Again, feel free to take pictures of the slides. And again, this is recorded. When we are talking about components of adult CPR, we are referring to the compression rate of 100 to 120 compressions per minute. We're talking about the compression depth that is pressing on the patient's chest about 2 inches. Allow the chest to return to its normal position between compressions. Minimize necessary interruptions in chest compressions to less than 10 seconds. Each breath lasts 1 second, allowing the chest to begin to rise. You're going to perform 30 compressions, followed by the 2 breaths. I will do a demonstration so everybody has an understanding of what the compressions look like and what the breaths look like on a mannequin. If you are doing your skills competition, or what you can be prepared to see when you take a class with the American Red Cross. We're going to talk about chest compressions, and the most important thing is using correct hand placement on the mannequin and on the patient's chest. Using correct body positioning, which is very key, so you don't hurt yourself, and making sure that the chest compressions are correct. And that correct body positioning would include locking the elbows to keep the arms straight, which is very important. You want to press fast and hard on the individual and ensure, and this is very key, that they are on their back on a hard, firm, flat surface. And again, later on, I will demonstrate the process on a mannequin on giving proper chest compressions, using proper hand placement, correct body positioning, making sure your elbows are locked and keeping your arms straight. And as I previously stated, doing 30 compressions followed by 2 breaths. When we are referring to giving breaths to an adult, we want to tilt the head to a past neutral position. We want to pinch the person's nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Blow into the person's mouth for about 1 second, enough to make the chest begin to rise. You want to pause between the breaths to allow for the chest to fall and the air to exit. Take another breath, make a seal, and then give your second breath. And again, if you've never taken a CPR class before, this may seem a little strange or something that you're not familiar with. I will go over it and demonstrate it so you have a better understanding. You can actually see it in progress so you know what these skills are attached to when we are giving breaths to an adult. AED review. When you get an AED, you always want to turn it on and you want to remove clothing covering the chest area if necessary. You want to use adult pads for children older than 8 years and weighing more than 55 pounds. You want to attach the pads. Place one pad on the upper right side of the chest and one pad on the lower left side of the chest, a few inches below the armpit. And again, I will demonstrate this process for you so you can have a better, clear understanding of where the pads are placed on the mannequin or on the patient. Plug in the pad connector into the AED if necessary, and yell clear for analysis and clear for shock, and then push the shock button and continue CPR. And yelling clear for analysis is very important when we're working with an AED. You want to make sure all hands are clear off your mannequin and off your patient when you are utilizing an AED and getting ready to administer a shock. We're going to go into the phase of adult choking. We're talking choking is a common in older adults and young children. It occurs when the airway becomes either partially or completely blocked by a foreign object, such as a piece of food, a small toy, body fluid, such as vomit or blood. We want to make sure we're able to get that item out so the person can breathe. The common signs of choking: the person may look panicked, confused, or surprised. The person may be turning blue, or they may hold their neck with one or both hands. You may hear coughing, high pitched squeaking noise, or see them trying to cough, speak, or cry, but hear nothing at all. That is an indication and the common signs of someone who is choking. Administering naloxone using a nasal spray. This is what we call Narcan, and we're going to go into a demonstration. And I'm going to actually show you a slide of how it's supposed to be administered and step by step instructions on how to help someone when you're administering Narcan. And in addition to that, showing you how, in the most easy and effective way, to use epinephrine when you're using an auto injector, the proper place, the placement, some of the things you need to make sure is there as the medicine and it's not expired. So those are some of the things that we're actually going to go into just to kind of give you a better understanding, an idea of how to use them so you can be proper prepared if you're doing your competition or if you're going to take a class with the American Red Cross. If you want to take a CPR class, you can call the number that is listed on here. If you want to take a photograph of it, it is 1-800-733-2767. This is the phone number you can call. Find out a American Red Cross building in your area where you can take a CPR class or a BLS class. You can also go to our website, which is www.redcross.org. It gives you all the classes that we offer and the areas, and it also gives you the time as well when the classes are going to be set. It's a great opportunity to take a class, to know CPR. It's a great life-saving skill to have. In addition to that, we also have a mobile app. So if you have an Android or an Apple, you go into the Play Store, you go into the Apple or Google, and you type in American Red Cross. You're going to see an app that comes up with a Band-Aid. That is the American Red Cross app. Go ahead and download it. It will answer any questions you may have. You can type in the search bar if you have a question about a bee sting, burns, heat stroke, choking, vomiting, seizures, asthma, any of those questions you may have. You type it into the search bar and it'll give you the answers that you need. It is a great app to download and give you the information that you need. If you have any questions about first aid, life-threatening bleeding, sudden illness, poison, or CPR. It's a great app to have. And again, our number is 1-800-733-2767, which is 1-800-RED Cross. We are going to hold off on this last one. This is a QR code that we're going to do at the very end. So I want to hold off on that. But what I want to do now is I want to go to and see if anybody has any questions about what we went over so far. So let's open up the Q&A before we go into the hands-on portion, the demonstration with the CPR. If you have a question, you can put it in the Q&A box. We will answer the questions, or you can raise your hand, and maybe you can come off mute and ask your question, but use the Q&A function to type it in and ask your question if you have any questions before we go into the hands-on skill. And I will hold on a second to see if we have any questions. Looks like we have one question in the Q&A. The question is there proper dress wear? When you're taking this, that's a great question. Thank you for asking that. If you're going to take a CPR class or any type of BLS class, you want to wear comfortable clothes. And the reason why is because you're going to be up and down a lot in the classroom on the actual floor. Obviously, the instructor will offer you knee pads, but you will be up and down a lot. So you want to wear very comfortable clothes when you're taking a CPR or a BLS class with the American Red Cross. So great question. There's a question in the chat. When do you have to administer the nasal spray, and what state will a person be? And that will make it necessary. That is a great question. When you're talking about helping somebody with Narcan and a nasal spray, the first thing you want to do is always check your scene to make sure it's safe before you approach. Once you've done that, you will do the shout, tap, shout on their shoulder. If they do not respond, we would like you to perform CPR because the person is in cardiac arrest. You want to yell out for somebody to call 911, grab a first aid kit and an AED. And if you suspect that it is a overdose, you can give them the Narcan. Wait 2 to 3 minutes. If you do not get a response, you want to check for their breathing. If you don't see breathing, please start your CPR because, like, again, this person is in cardiac arrest, but please remember to call 911 or get someone else to call 911 if you have someone else there with you. So that is a great question. The next question: do you have to be a certain age to take lessons? We have a That's a great question. We have a babysitting class that you can take along with your parents up to the age of 13. Anything if you're 14, 13 and above, 14 and above, you can take our basic first aid CPR AED class. But we do have a babysitting class too as well. So any questions you have about that, when you call 1-800-RED-CROSS to book a class, tell them what you want. They will ask you and they will put you into the right class. And parents can also take the babysitting class with their child as well. So that's a great opportunity for both to get certified at the same time. So that's a great question. In CPR, do you use any other tools such as a bag valve mask? If you have a bag valve mask, and a lot of times you don't have one, we just want you to do the chest compressions because you're actually flowing oxygenated blood throughout the victim's body. If you don't have a bag valve mask, which is called a BVM, just continue to do the chest compressions until help arrives. But if you do have a BVM, please administer the oxygen that is needed for that individual. That's a great question. What is the most common mistake that happens during CPR, and what can I do to avoid it? That is a great question. The answer to that is the common mistake is not proper hand placement, not pressing deep enough, going too slow or going too fast, not checking the scene for safety, not having somebody calling 911, and for a person to not be on a hard, firm, flat surface. And that is a great question. We are going to address that. When you see the skill, I'm going to give you a lot of tidbits to help you prepare when you're performing CPR in your classroom or for your competition. Great question. When putting on the patches for the AED for the person, is it needed or not needed? When you are putting on the pads for an individual, there's a diagram on the AED pads where they are placed on the patient, which will be top right, lower left. That is the proper placement. It doesn't matter which pad is placed on your patient. It's just a matter of they have to be in the right place, which is top right, just below the clavicle and right underneath the left armpit. And again, I will demonstrate that in a second. So great question on that one. There's some great questions coming in. I really do appreciate that. Hopefully I can get to all of them. If I don't, then again, you have my email address. You can send it to me or you can call 1-800-RED-CROSS. Another question is, how long are the sessions usually? Our CPR classes are breaking down into two components, and that's also a great question. You can take what we have called is a full first aid CPR AED pediatric class, which is anywhere between 3.5 to 4 hours, or you can do what we have is called a blended learning class, which you will do a online component at home at your leisure. Once you've completed the online component, you come into the classroom and you do a hands-only skill component that will certify you with the instructor to have a first aid CPR AED certificate. So there's two type of components depending on what your schedule is like and what type of class you would like to do. So that is a great question. What would you do if an AED is not available at the time or it comes late? It's a very great question. When you're talking about an AED is not available, we like you to do is continue to do the compressions until EMT arrives or somebody else is there to assist you with the compressions. Don't waste your time going to find one. If there's not one available, continue to keep doing the compressions and the breaths until advanced training comes and help you out in that situation. So that is a great question. Is there a difference between men and females when doing compression on that person? That's a great question. No, there is no difference. You want to treat that patient the same. This person is in cardiac arrest. They are not breathing. We want to get that oxygen flowing through the body. So we're going to do the 30 compressions and the 2 breaths. There is no difference between a male or a female patient. Very good question. The next question is, what is a useful tip to help make sure the chest properly recoils? That is a very great question. When you are doing your compressions, your hand placement is very important. You want to be able to press down at the depth of about 2 inches on your mannequin or your patient. You want to allow that chest to recoil fully before you hit the next compression. Don't take your hands off the chest, just allow the chest to recoil back to its normal position to allow that oxygenated blood to flow through the body. So that is a very, very good question. If you're helping someone by doing CPR, but you're the only one there, how can you call 911 while doing CPR? It's a very good question. When you are by yourself and you're doing CPR and you need to call 911, please, before you start your compressions, you want to put your cell phone on speaker and put it next to you. That allows you to keep your hands free. You can get a dispatcher on the phone. They're going to talk to you and let them know that you are currently doing compressions on someone, and they're going to send you some help right away. So please use your cell phone, use your speaker, because you want to keep your hands free to continue to doing compressions to help the person that you're helping out. So that's a very good question. The next question is, what are you doing if you're doing CPR on a kid and an AED comes and it doesn't have pads for children? Wow, that's an awesome question. Whenever an AED arrives, normally they're going to be one set of pads in an AED. Those pads are typically adult pads. Adult pads can be used on any patient. It could be an adult patient, it could be a child patient, and it can be an infant patient. However, the only difference is the pad placement, which I will show you later. On an adult, again, top right, lower left. On a child, the same thing, top right, lower left. If you're using pads on an infant, your AED pads cannot touch. So in that sense, you will put one on the front of the infant and on the back of the infant, right in between the shoulder blades. So that's a very good question. Infant pads you can only use on infants. The shock is not strong enough to use on a child or an adult. The next question would be, how do I identify a child or an infant? And that is also a great question. Infants will be from newborn to the age of 1. A child is considered 1 to the onset of puberty, which is be 13 or 14. But from a physical characteristics, you want to look at underarm hair or chest hair for a young male or breast development in a young female. Anything above that is considered an adult. So that was a great question. How long do you need? This question is interesting. How long do you need to administer CPR on a person before pronouncing them dead? We don't want you to pronounce them dead. We just want you to continue performing CPR until help arrives. When help arrives, they will take over from there. We want you to do the best that you can for your ability that you have been trained to do. And just continue to keep doing compressions. Hopefully you or someone else has called 911 to get that medical staff to help you immediately. But we want you to continue to keep on doing and do the best that you can to get that oxygenated blood flowing through that patient's body. So thank you for that question. The next one is, how long is the certification valid for? Your certification, if you take a class with the American Red Cross, they are valid for 2 years. So that's how long and then before the 2 years is up, we will send you an email and says, hey, thank you for taking the class. It's time to renew. We don't want you to wait to the last minute to renew. We want to try to get it out to you 90 days before you expire. So yes, it will expire in 2 years. Next question. Is the breathing only necessary if a person isn't breathing? If they are breathing, just the compressions are necessary. Great question. If you do a shout, tap, shout, or you're checking for a pulse, or you're looking to see if someone's chest is rising, you do not need to perform CPR because the heart is actively pumping blood through the body. If the person is not breathing and their chest is not rising, we need to assist them. So start your compressions. After you've done your 30 compressions, you will then continue to do your 2 breaths. And I think once you actually see the demonstration, a lot of your questions will come into light and you will see how compressions are done on a mannequin. And hopefully, you never have to do it. But if you have to do it on a patient, you have a better understanding of the body positioning, how far you need to press down, the infant, the use of an AED as well. Okay. So I see that there's no more open questions, but I do thank you very much for those questions. Those were very good questions. So, what I want to show you now is the proper hand placement when you are performing CPR. And as you can see here, hopefully you can see my screen. Again, use proper hand placement. You want to place the heel of one hand in the center of their chest with your other hand on top. Interlace your fingers and make sure they are up off the chest. Use correct body position. Position your body so that your shoulders are directly over your hands. Lock your elbows to keep your arms straight. You want to kneel beside the person. Your knees should be near the person's body and spread about shoulder width apart. And remember, you're going to push hard and fast, about 2 inches, at a rate of 100 to 120 compressions per minute, allowing the chest to return to its normal position after each compression. So, this is what the proper body placement and hand placement is for when you're doing compressions. Okay. The next one I would like to show you is when you are using your Narcan. And when you are using this spray, the first thing you want to do is verify that the medication has not expired and it is the name of the patient that you are working with. The second one kind of demonstrates how you hold the device with your thumb on the bottom of the plunger and your 2 fingers on either side of the nozzle. You don't want to block the nozzle with your fingers. So it goes in between your middle finger and your pointer finger. You want to place and hold the tip of the nozzle on either nostril until your fingers touch the bottom of the person's nose. As you can see in this diagram, you want to make sure it's inside the nostril. Press the plunger firmly to release the dose into the person's nose. So this is how you want to hold the Narcan when you distribute it. And there's 2 ways to actually do this. So this is the first one, which is the most common one. But I also like to show you the second one, which is a atomizer. Okay, again, always verify the medication, the name, and make sure that it has not expired. Okay. You want to uncap the medication vial or the syringe, whichever one it is, and it's also pre-filled. You want to be able to attach the medication vial onto the syringe if necessary. Sometimes it's already attached. Screw the nasal autonomous spray device onto the top of the syringe. Spray half the medication into each nostril. You want to keep an eye on this person for about 2 to 3 minutes. If you don't see it, you can also reissue the medicine again one more time. But these are the 2 proper ways to actually help somebody when you're delivering Narcan in these two special. The first one that I showed you is the most common one. The second one is sometimes used in certain areas, but that first one is the most common one that we do. Okay. When you're doing pressure for direct bleeding, if someone is actually bleeding, you want to be able to place the dressing on the wound. The most important thing is making sure you use both of your hands and firmly direct that pressure over that wound until that bleeding stops. That is the most important thing. If you have PPE, please make sure you use the PPE. And if you don't know what that means, it's personal protective equipment, which would be the latex gloves that you see here, or a face shield or a breathing barrier, which we call a pocket mask or a face shield. And I'll show you and demonstrate either one of those to you in a second so you have a better understanding. You want to be able to hold that until the bleeding stops. If a tourniquet needs to be applied, then you apply the tourniquet. Again, always make sure somebody is there to relieve you if you are too exhausted to continue or that particular situation becomes unsafe. But also make sure you apply that direct, firm pressure until that bleeding stops. It may hurt the patient you are dealing with, but please just make sure that you apply that firm and hold that direct pressure. Okay. What we want to do now is actually go into the skill of the CPR on an adult. I'm going to demonstrate that. I'm going to show you an AED and also show you how to do CPR on an infant to give you a better understanding of body positioning, hand placement, thumb placement, because we use a technique called the encircling thumbs when we are doing compressions for an infant to kind of give you a better understanding, and also the pads for an AED on an adult and on an infant. The Q&A will be open after the skills, but if you have a very pertinent question as the skills are going on, then just go ahead and put it in the chat. And once I'm done the skills, I will come back to the question. Hopefully I can answer it. If not, I'll get someone who can, or our mobile app will give you answer any questions you may have. Okay, so give me 1 second while I adjust my camera so you can actually see the mannequins.
And Mr. Clinton, I can see your, oh, there you go. You got it. And we can see your camera. It looks great.
Okay. And can you see the mannequin?
Yes.
Okay. So what I'm going to do is kind of give you an idea of what the mannequin actually does. And as you can see, it lights up. The first thing you want to be able to do is place your hand in the center of the chest, just below the nipple line. You want to make sure you interlock your fingers. You want to be able to press down on the mannequin, making sure your knees and shoulders are parallel to each other and keep those elbows locked. We are going to perform 30 compressions on the mannequin. Again, counting out loud is very important because it helps you keep track of your compressions. It keeps your pace. And if someone is coming to help you or assist you, they know exactly where you are in your rotation of your compressions. Okay? And we will start 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Remember, allowing that chest to recoil and allowing that oxygenated blood to flow through the body. This is what we call our pocket mask. And this is what we're going to use to apply that breath to our mannequin. If you're not familiar with the pocket mask, we have something that we call a face shield. And the interesting thing about the face shield is that it has a diagram on the face to give you a better indication of where it is placed on the patient's face. Okay. So the first thing we'll do is we'll start with the pocket mask. When you have a pocket mask, you can kind of see it's almost shaped like an egg-like kind. So you want to take this part and you want to tilt it in between the eyes and lay it flat down on your patient's face. We call something called an EC seal, which is E and then the letter C. We want to make this complete seal in order for this chest to rise. Hopefully I get it right. So let's see. Let's make our E. So we got our E. Here's our C. We got to be able to tilt the head back because we want air to flow. So let's see if I can get this chest to rise. If not, I'm going to need to make some adjustments. Here we go. Hopefully that was good enough and everybody can actually see that. That is the breaths that is going inside your patient to allow that chest to rise by utilizing this pocket mask. Now, with the face shield, as you can see, there are two different sides. The side that we want, and again, if you look at the diagram, it says this side up, and then the other side is kind of blank. So you want to lay this directly over the patient's face. Again, it has a diagram where you pinch the nose. And hopefully everybody understands if we don't pinch the nose, the air leaves the nose. We want it to stay in to get this chest to rise. We have to make a complete seal over this patient's mouth. Remember, still tilting that head back. So let's see if I can get this one to rise with the face shield. Good. When we're using these two items, whether it be the face shield or the pocket mask, make sure you have the complete breaths in there as well. Okay? Again, let's try 30 compressions and 2 breaths continuously and see if I can get it to work. Okay? Make sure your hand and your fingers are off the chest, and then lock your fingers, knees, and shoulders parallel to each other. Lock your elbows. And here we go. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Let's try our pocket mask. EC seal. Tilt the head back. 1, 2. And we will do this until help arrives, or there's another individual there that can relieve us because this is a tiring process. But we got the blood flowing and we got the air inside our patients, which is good. Okay. Here is an AED. Interesting part about this AED is only 2 buttons. There's on and there's your shock button. The first thing you want to do,
this is a training device only. No shock will be delivered.
Just turn it on.
Attach pads firmly to person's bare chest.
Here are your pads. And as you can see, there's diagrams on where they're placed on the patient's body.
Plug-in connector.
So once you get the one pad on,
check connector and pads.
You get the second one on.
Check connector and pads.
Got to be quick about it. Next thing you want to do is yell out that magic word. Clear.
Check connector and pad. Don't touch person. Analyzing.
Clear.
Shock advised. Press flashing shock button. Shock delivered. Start CPR.
The one thing I want you to hear, and hopefully you can hear it, is that you'll hear your AED go through a sequence of rhythm. That beeping that you're hearing, that is the rhythm you are supposed to be following when you're doing compressions, the same as I did as when I was counting 1 and 2 and 3 and 4. It's the same rhythm as this. This is a great way to make sure you're actually doing it the correct way if you follow this. You have to do this until
1
the
minute
machine,
and 30 seconds of CPR remain.
the machine will tell you how much time you have left. You will continue to do this until this machine says stop. When it says stop, you remove your hands. This machine will reanalyze this patient's heart. If another shock needs to be administered, it will say hit the shock button. If the heart is okay, but we still need to keep the blood flowing, it will say continue compression.
1 minute of CPR remain.
And that's how you follow that. Okay? Good. Turn this off. Now, let's focus on the infant. Hopefully everybody can see the infant. Again, remember, hard, firm, flat surface with the infant. With the infant, what we typically do is place our hands in a position such as this. We shift our body slightly. We take our thumbs and put it just below the nipple line, and we're going to press. We want to keep that same consistency and that same count that we did with our adult. Nothing changes except our fingers. We're not pressing down 2 inches. We are doing 1.5 inches for an infant. I've done my 30 compressions. Now I want to breathe into my infant. Keep in mind with the infant, you don't pinch their nose. Your mouth goes over the infant's nose and mouth to allow that breath to get into it. So let's see if I can do it. To get that chest to rise. When we are doing an AED for an infant, if I was to place these pads identical as the adult, you can see that the pads are touching. The pads cannot touch. You can still use adult pads. What you would need to do is take one pad and put it in the center of the chest. Your second pad goes on the back between the shoulder blades, but be very careful. You want to be able to take this infant and roll them towards you. Never roll them away from you, okay? So you roll them towards you. You take that second pad and you place it here in between the shoulder blades. You lay them down, let the machine analyze, and continue that process as need be. If you are using a pocket mask for an infant, you can use this one, but you would have to turn it so it covers the entire face. But we also have a infant pocket mask, which is a little bit smaller. So you attach your pocket mask, you place it on your infant, you tilt that head back slightly. Hopefully you saw that chest rise. And that's how we perform the CPR for an infant, for an adult, and the use of an AED for an infant and an adult. Your pocket mask for your infant and your adult, along with your face shield for your infant and for your adult. Okay? So what I want to do now is open up the Q&A and see if we have any questions. Okay. Let's see what we have. If our hands are not big enough and we have more than one rescuer, is it possible to hold the pocket mask using two hands while the other person does CPR? That's a great question. If your hands are too small or not big enough and you have another rescuer there, if that rescuer with the larger hands can perform both, then that will be great. If you decide you want to be able to hold the pocket mask and the other person does the compressions, that's great. Make sure the two of you are communicating effectively enough to make sure after the compressions that the breaths are provided. We don't want to wait in between compressions and breath. It has to be consistent. Great question. What if we break the person's chest bone while doing CPR? I've never had that question asked to me, so I really do appreciate that. You must be very strong if you're breaking a chest bone. But if you do break a chest bone, that means your hands are completely high. They're too high. They have to be in that sternum area. Okay. There could be a little bit of damage to the rib cage to the patient, but that's perfectly okay. But you won't have any harm with the chest bone. But that's a great question. How long is too long for CPR for an infant? There's no such thing as too long. Again, if you've had somebody call 911, depending on where you are, depending on how long it takes for them to come, whether you're at a school, home, the mall, church, you want to be able to continue those compressions until help arrives. Now, if you have an AED and you're performing CPR and you use an AED and all of a sudden you have movement from the patient you are working with, then you can stop. Don't let them get up. Do not turn the machine off. Just keep them there. Keep talking to them until the medical staff arrives. But don't ever stop doing compressions. Okay? If an infant has a suspected head neck spine injury, do we still try putting the second pad on their back or do we go without the AED? Great question. If you suspect that the person you are helping has a head, neck, or spine injury, do not move them. Do not put the pad on the back. Just continue to do CPR if needed. If they are alert and awake and you don't need CPR, then just keep them there, continue to talk to them, support them until medical help arrives. During a recent CPR training session, I was told to focus on chest compression rather than providing rescue breaths. What do you recommend? That's a great question. For the American Red Cross, we teach both. We teach the compressions along with the breaths. If you feel uncomfortable or you don't feel willing enough or you don't have a face shield and you choose not to provide the breaths, as long as your compressions are consistent, then continue with that. Don't worry about providing the breaths. But we teach it because it's an effective method in order for the blood flow to go through the person's body. So yes, continue that. When you are alone during an emergency, do you call or care first, or are there special scenarios? I would like that. Sarah asked me that question. I want you to give me a scenario and I can better answer it because there are certain scenarios where you call first and there are certain scenarios where you give care first. So let me throw that question back at you. What if you're sitting at the lunchroom table with a girlfriend and she has an allergic reaction, or let's say you at Chick-fil-A and she has an allergic reaction to the peanut oil in a salad and she's starting to break out. She has an EpiPen. Do you call 911 and then administer the EpiPen, or do you give the EpiPen and then call 911? So that would be one of those special scenarios. In that situation, you would give care and then call. The same with choking. You want to have somebody else call 911 and you give them the care. But if you're by yourself, That care is very important because you want to be able to have somebody get there immediately. Okay, great question. Where do you check a pulse for an infant? When you are checking a pulse for an infant, you want to actually go in this area here. This area here is for a child and an adult, but when you're doing an infant, it's in this area here. So that's a very, very good question. Why is it not recommended to turn the infant away when you're putting on AED? Oh, that's a great question. If the infant is on a hard, firm, flat surface and you roll them away from you, there is a possibility that you can lose the handle or the grip on the infant and they can fall off or roll over. You want to be able to roll them toward you so you have better support, and also rolling them towards you, you can see the pad placement on the back. And if the infant starts to vomit, you can actually see it by rolling them towards you as opposed to away from you. Good question. When doing CPR and there's someone else there, how often should you switch CPR and give breaths? Great question, Isabella. That would be every 2 minutes. You want to be able to switch every 2 minutes when you're doing the CPR and giving the breaths. If you are by yourself and you are extremely exhausted, go ahead and do 2 rounds of CPR, take a 10-second break to yourself, and then go right back into it because you want to keep that blood flowing. But if you have somebody there, you want to switch every 2 minutes. Where can we commonly find AED devices in buildings? That's a tough one. From an AED perspective, it is not something that everybody has to have. We would like them to have it, but the normal places you will find them would be the movie theater. You would find them at the mall near the restroom. If you go to a gym, you will find it at the check-in desk. A hotel would be at the check-in desk or a pool. BJ's, Costco, Walmart, Target is usually at customer service. There are some places have it and some places don't. But when you download our app, if you type in the search bar AED locations, it kind of picks up your location and it can kind of tell you where the nearest AED, I think, is in a 5 to 10 mile radius. So they're not everywhere, but when you go to the movies or you go to the mall and you walk into the restroom, you'll see them planted on the wall inside a box that says AED. You'll see them at YMCAs, daycare centers. You'll see them at hotels. If you go to an amusement park, you will see them there. So those kind of places have them too as well. Do the compressions vary depending on the age of the patient? Very good question. No, the compressions do not vary. The only time that does vary is when you are in a BLS setting and there's more than one provider for an infant or a child. The compression rate goes from 30 to 15. So it'd be 15 and 2 as opposed to 30 and 2. That is the only time, but normally it's always going to be 30 compressions and 2 breaths. Again, going back to the other question, if you choose not to give breaths, just continue to do hands-only CPR until help arrives. How many compressions per minute for an infant? That goes the same as the actual child or an adult. The only difference is the depth that you actually push down. Instead of 2 inches, it's going to be 1.5 inches for an infant. How do you measure the breath into an infant, adult, and how long in between each breath? When you're doing the compressions and you go right into the breath, you want to breathe, take a minute, and then breathe again. You want to do normal breaths when you're giving them for an adult, child, or the infant, but you don't want to wait no more than 2 seconds in between each breath. You want your breaths can be continued. So you breathe, you take a breath, and then you breathe right back into the patient you're working with, whether it's an adult, child, or an infant. How do we ensure we don't deliver too much air? I've heard about complications where air from a CPR goes into the stomach. Great question. That is when we do excessive breaths. We are only doing 2 breaths. If we do 2 breaths and we don't see the chest rise, that means the head is not tilted back or the nose is not pinched close enough. What we don't want to do is continue to keep blowing and giving breaths. We want to do the 2 breaths and then we go right to the CPR, chest compressions. We come back and do the breaths and we go to the chest compressions. Don't continue to keep doing breaths because then it is too much air inside your patient. What happens when the pads are touching? Great question. When the pads are actually touching on an AED, it doesn't read the heart correctly and it will not send a shock, or it could send a shock and cause a spark and it doesn't effectively hit the heart of the patient. So please make sure those pads are not touching. If you're working with a patient and the chest is very small, refer to the front and the back. But if the chest is wide enough, you want to go top right, bottom left for your patient when you're applying AED pads. Do you have to be medically registered to perform CPR and the shock? Great question. You do not. If you are with your girlfriend and you're leaving the mall and someone falls in the parking lot, hopefully it never happens, you can call 911, give them your situation. They can walk you through the steps of helping somebody with CPR. And hopefully that mall has an AED. Your girlfriend can go grab the AED. And if you're not familiar, the dispatcher will walk you through the steps until EMT arrives. So do the best that you can. But taking a CPR class with the American Red Cross will give you the knowledge, the skill, and the courage and the consistency, along with the confidence to be able to help somebody if need be. So great question. I think I read that one. Why is it not recommended to turn the infant away? I think I answered that. If I didn't, I apologize. But yeah. What do you do if you have 2 people who need CPR? Wow. But you're alone with no AED nearby. Who do you go to first? That's a tough question. When you are dealing with, hopefully you never come across this, but if you're dealing with 2 people that are down, remember, your safety is first. Always check your scene to make sure that it is safe. You do the shout, tap, shout on both of the patients that are down because one may respond. But if neither one of those respond, you want to do a round of CPR, which is 2 minutes of CPR on that first patient. You want to then put them in what we call the recovery position. And then you can move to your second patient and do the CPR on them. Hopefully this never happens, but also put your phone on speaker, call 911. Hopefully somebody can assist you with that second patient, but work on the first one, 2 minutes of CPR, recovery position, go to the second one, 2 minutes of CPR, recovery position, and continue because we want to keep that blood flowing through that patient's body. Hopefully that never happens, but hopefully if it does, then call 911 and help do the best that you can in that scenario. Are Narcan's infant supplies and a regular first aid kit? No, they are not. That is something you want to get from a pharmacy. It's not in the first aid kit. If certain buildings or hospitals or urgent cares or schools, it may be with the nurse or it may be in their first aid kit, but a normal one, you would not see it in there. Okay. That's it. It doesn't seem like there's any more questions. I want to thank everyone who chimed in, everyone who popped on the webinar. Good luck to you with your competition. It's a great opportunity to learn CPR, have fun doing it. If you've never taken a class before, call 1-800-RED Cross, find a building in your area that offers our classes. It's a great skill to have. Again, hopefully you never have to use it, but it'd be great to know it just in case a family, a friend, a classmate, a teacher, somebody needs your assistance. It gives you that confidence to be able to help someone. Again, my information was on the slide. I will go back to it if anybody needs it. Before I let anybody go ahead and take a picture of the QR code. There are some questions there that will really help me out going forward and kind of answer any other questions you may have. So go ahead and scan the QR code, answer the question, hit submit. It's going to come to me. Again, I thank each and every one of you for hopping on. For the ones who didn't, again, this is recorded. They can go back and watch it and listen to it. Hopefully, the skill set that I've demonstrated today gives you an opportunity to understand when you go do your competition. Again, good luck to everyone. If you sign up for a class with the American Red Cross, what I demonstrated is something you're going to be demonstrating for the actual instructor. Again, good luck. It's been a pleasure. Thank you. Hopefully, everybody doesn't have to perform CPR on anybody, but if you do the best that you can. Don't forget to check your scene. Call 911. Get your first aid kit. And do the best that you can. But again, have fun in your competition. I wish everybody well. Happy holidays, happy New Year. Stay safe. Again, this QR code and send it in and answer the questions. I really do appreciate it.
Thank you so much, Mr. Clinton. We appreciate you joining and sharing all of this great information. We will include your link and your resources in a follow-up email, so everybody will get it through email along with the recording.
Okay.
So, thank you so much. I appreciate it, and have a great night.
Thank you very much. I appreciate it. Have a good one. Happy holidays to everyone.